Hi, I'm Dr. Lista, and here we are in operating room number 2, which is one of our operating rooms here at the Plastic Surgery Clinic. And what I thought I'd like to talk a little bit about is our special procedure we do here for breast augmentation, which we call the sitting up breast augmentation. So lots of patients ask us, how do we do breast augmentation, and is it true that we do the operation sitting up? And the answer is yes. We do it a special way so that the breast augmentation is done with you, the patient, in the sitting position. So why do we do that? Well, most plastic surgeons do the operation lying down. And in fact, for the first 15 years of my practice, that's how we did the operation, with the patient lying down. The problem is that lots of times when you do the operation lying down, the breasts look great, and then when the patient stands up in the post-operative period, you ask yourself, why didn't it turn out the way I thought? And the answer is breasts look different lying down than they do sitting up. Those of you with some significant breast development know that when your breasts are lying down, they look one way, and when they're sitting up, they look another way. And so if you do the operation lying down, you can have a problem where the breasts look great lying down, and then the operation doesn't turn out the way you expected. So that's why we developed the technique of doing the operation with the patient sitting up. That's the way we want breasts to look good, with the patient in the sitting position or in the standing position. We expect them to look great. So our specialty here at the Plastic Surgery Clinic is giving natural results. So we don't make great big strange looking breasts. We want breasts that look beautiful. We want breasts that if someone sees you naked, they're just not sure. Do you think those breasts are real, or are they not? They look really natural. So we want breasts that suit your body, have a beautiful shape, but most importantly, look natural. So one of the ways we do that is with the sitting up breast augmentation. So I'm sitting on, you can't see it, I'm sitting on an operating room table here in OR2, and it's a specially devised table that allows the patient to sit up. So the patient comes into the operating room awake. She lies down on the operating room table. We cover her in a warm blanket. We start an IV and put the patient to sleep. And then we go ahead and do the operation. But before we start, we have the patient, we sit the patient up, and so she's sitting up during the breast augmentation. And then during the operation, I'll stand back and say, okay, how do they look? Are the breasts looking the way the patient asked? Is the size right? Do we have enough cleavage? Do we have enough superior fullness? Do we have enough lateral show? Is the inframammary crease right? Are the breasts symmetrical? Do they look the same? Is it how the patient expected it to look? So we may take a photograph, we may look at the patient's photographs, and I'll ask the nurses, what do you think? And they'll often say, I think this one needs to be adjusted a little bit. And so we're adjusting it during the operation, even changing the implant to make it look right. And what we really want is we want in the patient in the upright position to have a beautiful, natural looking breast. That's what we do, and that's our specialty. Thanks for watching.